Hello, my name is Margaret Curry, and I am a registered nurse, currently living in India, and I've had the pleasure of living overseas for the last few years. My dissertation work is going to be on simulation and teaching about culture, but using David Cobb's experiential learning. So in the coming slides, I'll discuss his work and his background and how that ties into my dissertation. So hope you enjoy. In 1966, David Cobb experienced his first experiential learning um, interaction with other people. And from that experience, it really guided him to delve into experiential learning and find out what other theorists had said about it. And really, he dedicated his academic and scholarly life from that point onward. Um, he also then developed the Kolb's experiential learning cycle, which is listed here, which is a student would be experiencing, reflecting, thinking, and acting upon an experience, and then also developed experiential-based learning systems, which itself is a great site that you can refer to, and it's in my references. In my philosophical analysis paper, this was my guiding question, and I'm talking here about my dissertation work on using standardized patients in simulation and using Cobb's experiential learning to help increase knowledge of cultural humility. So I'll talk more about that in the coming slides. So my guiding question addressed a few things, one of which is the use of simulation. And so for my nursing colleagues here in my course, we use simulation all the time. We can able to teach and show experience to students they wouldn't necessarily see in a clinical setting. The first image above, you can see nurses working with a mannequin, a patient scenario. The second image below is what we call a standardized patient. That's the person that's in the bed. And we refer to them really as an actor. And they would be part of the case and be scripted and be able to assist the case forward. So in simulation, not only will I use standardized patients, but I'm going to introduce my students to cultural humility, which was coined, this phrase was coined in 1998 by two physicians, and has since then a theory of cultural humility has been developed by Dr. Ferranda. And in her work, she talks about the antecedents of diversity and power imbalances, but the attributes that cultural humility can bring to the bedside, which is a self-awareness and egolessness that needs to occur when we care for our diverse patient population. So as Cobb himself would say, that he didn't develop experiential learning, and really it's the theory built on many, many theorists that came before him. And this is just a small list of those that he gives credit to. We mentioned Cobb's experiential learning earlier, but this is just more of an overview of what he calls each part of the cycle, which he refers to as a concrete experience, a reflective observation, an abstract conceptualization, and then lastly, active experimentation. There's numerous contributions of Cobb to the practice of experiential learning, and I would highly recommend that you check out his website, which is in my references. And there's videos available and some other tools that you could bring to your classroom setting. Like anything else in the world, there's opponents and people that will criticize the work of Cobb or any other theorist for that matter. And Morris mentioned that he he believed that Cobb should add more text to concrete experience, for example. He thinks it should be contextually rich. And then another researcher, Birkensteiner, mentioned that he believed that the graphics of his experiential learning cycle could be improved upon, and he felt they needed to add a timing element or a timing period to his work. Not only does Cobb's experiential learning and his learning cycle align with my philosophy of learning, it also aligns with a professional organization known to many nurses as QSIN, which is the Quality and Safety Education for Nurses. And within that, we have things we need to follow, which is knowledge, critical thinking that we pass on to our students, skills, and an attitude or behavior values, all of which can be brought into my dissertation. So I hope you've enjoyed this presentation. I would encourage you to go to Cobb's site, EBLS. It's listed in my references, and hopefully you have a good sense of my dissertation and my work with simulation. Have a great day.